They call it bubble boy disease because the children who have it have to stay indoors, away from other people. It robs kids of their immune system, and if left untreated, most die within just a few years. Until now, those treatments came with very harsh complications, but doctors at St. Jude say they think they have a cure: DNA therapy. So here to talk more about this is our medical correspondent, Dr. Sujatha Reddy. This is a big deal for these kids.
It really is, because severe combined immune deficiency is a really bad disease to have. It is definitely caused by a genetic flaw. What happens in these children is they have a defective gene in their immune system whereby they can't make the proper immune cells to fight infection. So a simple cold could literally kill them. It's luckily not very common, 1 in 200,000. And prior to the gene therapy we're talking about right now, the only known cure was a matched bone marrow transplant from a sibling. But bone marrow transplants had a lot of complications, and it's very hard to find a true match. So this gene therapy is really very exciting.
Talk a little bit more about gene therapy and why it's so effective, especially here.
So what's happening in gene therapy is you are basically altering the defective gene by replacing it with a healthy gene. And what they did here, which I think is ingenious, is they actually used the HIV virus without the bad part of it to carry the good gene code to the patient's immune cells, because HIV, we know, loves the immune system. And by letting those HIV cells transfer this genetic material to the immune system, they've now got children that are 24 months out who have a healthy immune system. So it's very exciting. And they're actually looking at the same technique as a treatment or hopefully a cure for sickle cell. So gene therapy is really, I mean, this is cutting edge medicine, but it's very exciting. And as one of my friends said, there has to be something good that came out of HIV, and maybe this is it.
There it is. This is significant, and anytime we can say the word cure, I always think, what's going to be next?
You got it.
All right, Dr. Reddy, thanks a lot. Jeff?